Well, each year, skiers and snowboarders head to the emergency room after getting hurt on the slopes. Now, no one can eliminate the risk of an accident, but there are ways to take care of yourself to prevent serious injury. That is today's Health Watch. So joining us now is Dr. Jason Jennings, orthopedic surgeon with Colorado Joint Replacement at Advent Health Porter. Thank you so much for being here.
Thanks
we appreciate it. Yeah, of course, of course. First question is, how often do you see here in Colorado skiing and snowboarding injuries? I imagine it's quite a bit.
Well, there's actually thousands each year, as you can imagine. Yep. And most of those are bumps and bruising and minor injuries, but sometimes there are broken bones and ligament tears. So it really depends. I would say the beginning of the year is a little more hazardous than the end of the year, though.
Yeah. We had this little debate before we had this interview. Again, what are some of the more common injuries you see, and which of the sports between skiing and snowboarding do you see the most injuries?
Yeah, so I don't know that it's a 50-50 split, so I guess it just depends on the timing. Snowboarding, for instance, most people will fall directly on their hands. So wrist injuries are very common, such as a broken bone. And most of us in Colorado are familiar with ACL tears. You hear it in other sports, but you see that very common in skiing as well. So.
Yeah. Well, being a man of a certain age now, I can't do what I did when I was like 21 or even 15. But what are some helpful tips to have people who want to keep their bones and joints healthy if they want to head up to the mountains?
Well, I would first and foremost say if you're a novice and you don't know how to ski and snowboard, taking a lesson is probably wise. I do think consistency is the key. So year-round training is actually very smart. So upper extremity strengthening, lower extremity strengthening, and also cardiovascular fitness is what we recommend to our patients.
Yeah, that's always good advice. Now, if someone injured their bones or joints during skiing or snowboarding, when should they seek medical attention? Sometimes we're kind of like, oh, we can kind of go without it, but other times we should probably go. So what's the threshold there?
Yeah, I think if you're on the slopes and you can't move your arm and your leg after a fall or an injury, that's probably a big red flag that you should seek medical attention. As a general rule, most of the things we see, they're minor injuries. So if you go through a few days and it's not getting better, that's probably time to come to an orthopedic surgeon and get a second evaluation.
Yeah. Talk about the importance of just, wearing a helmet or even like wrist guards sometimes, or perhaps braces on your knees or elbows or something like that.
Yeah, protective gear can't be overstated, particularly helmets, right? So head injuries are uncommon, but if they happen, they can be quite devastating. So recommend that for 100% of people. Wrist guards in snowboarding actually have been shown to decrease the risk of wrist injuries. So I think those would be very important for snowboarders. And if you've had a history of an injury in the past, probably wise to wear whatever joint you've injured, have some protective gear there as well.
Yeah. Now, in years past, when before I go snowboarding, I try to do maybe like some leg workouts to work on my, winter legs, so to speak. Do you recommend that as well?
I do. It's pretty tough. A lot of us are weekend warriors, so you haven't used those muscles probably since the year before. So do your best, but probably the first 48 to 72 hours afterwards, plan for soreness the first time you go out.
Oh, that's always the case for me.
Yeah.
Doctor, thank you so much for joining us. We appreciate it. You can watch all of our health interviews on our website at cbscolorado.com. We'll be right back.